afternoon. I sincerely want to apologize for um, keeping you guys. So quickly, we won't waste time on this live session. I would start by introducing our guest. Our guest is a registered nurse, a registered midwife, and a registered public health nurse. And we are going to be talking about hemorrhoids today. So if you are just joining us or if you're just seeing this channel for the first time, this is what we do every month. So you can just click on the subscribe button and put on your notification so you can get notified whenever something like this is going on. Okay. Nurse Duchess, please, can you hear me?
Yes, I can.
All right. So we'll just go straight to the point. And the first question here, I I noticed that a lot of people were having problems with the name hemorrhoid, hemorrhoid, hemorrhoid. So the first question here is, what are hemorrhoids and how do they affect the body?
Okay. What are hemorrhoids and how do they affect the body? So, first of all, hemorrhoids are swollen and inflamed veins in the anus and lower rectum that can cause pain, itching, sometimes bleeding, and mostly just discomfort. Now, hemorrhoids can also be called piles. We all know it as piles. It's commonly known as piles. They are, let me say, the conditions that occurs when a particular area in the rectum and anal region are affected.
Okay, okay.
Okay.
All right. So thank you very much. So the next question is, what really causes this hemorrhoid? Because in some persons, they just wake up and they find out that they are they are suffering from something, and when they got to the hospital, they told them that it is hemorrhoid. So what really causes this hemorrhoid to develop?
Okay. So basically, what causes the hemorrhage is increased pressure on the veins around the anus and the rectum, and this pressure now can cause it to swell and bulge up and also stretch. Now, pressures can be caused from straining during bowel movements or sitting on the toilet for too long. Then there's chronic constipation, even chronic diarrhea can cause hemorrhoids. And finally, low fiber diets. And some research have actually seen that pregnant women pregnancy can also be a cause of hemorrhoids. So that's all. There are others too, but for now, these are the most common causes. Mhm. Hello?
Hello, Nurse Duchess.
Can you hear me?
Yeah, I can hear you. I asked a question. Did you hear me?
Yes, I answered.
Okay.
Mhm.
All right. So to the next question. So how common are hemorrhoids? And then who is at risk of hemorrhoid? Is there a certain age, or is is hemorrhoid more prevalent in certain gender or race, as the case may be?
Okay, thank you for that question. So hemorrhoids are quite common. In fact, they are the most common causes of anal conditions like anal pathologies, and they are
Okay.
subsequently blamed for almost virtually every anorectal complaint, like any complaint about pain in the anus or blood or bleeding in the anus. Now, for the gender that is mostly affected, It's, I would say it's both genders from the research I've made, both genders. And
Okay.
the age group that is mostly affected is from the age of 45 to 65 years. And why are they affected? Because the more we get older, the more these muscles around our anus becomes more relaxed, and that can be a risk for hemorrhoids. Pregnant women also are at risk for hemorrhoids. Obese people, overweight people are at risk for hemorrhoids as well. Then
Okay.
people who do heavy lifting, because as you're
Heavy
lifting those,
heavyweight lifts.
yes, heavy weights,
Okay.
because as you're lifting those heavy weights, it causes pressure around the pelvic region. That's it.
Okay. Okay. Thank you very much. So the next question is um, it has to do with the symptoms we have to watch out for. So, what are the important symptoms or important signs, or you can just discuss both the signs and the symptoms we should watch out for when dealing with hemorrhoids? What are the important symptoms to consider when dealing with hemorrhoids?
Okay. So basically, these symptoms can be classified according to the types of the hemorrhoids. But the most common symptoms are pain, bleeding, itching, swelling, sometimes mucus discharge, and then
Okay.
skin tags. That's when the skin in that area is lacking. That's it.
Okay. So, how would you rate the pain? How would you rate the pain in a ratio of one, a scale of 1 to 10? How would you rate the pain? Because some people have slight pain sometimes.
Hmm.
Some also have very severe pain. So
Okay.
how how painful should the pain be before we take it serious?
Okay. I would say that it should be, let me say, 7 at least. It's also according to the
Okay.
types, because you see grades of hemorrhoids, because there are 4 grades. The first 2 grades, you might not feel anything. You might just feel discomfort. But you see grade 3 and grade 4. And also there's a type of hemorrhoid that has blood clots in it. That
Okay.
one, the pain is very severe, up to 10. So yeah.
Okay. Okay. Thank you. So I've come to discover that you have worked with health practitioners, you have worked with doctors and other nurses in the public health sector. Now, can you just tell us how hemorrhoids are diagnosed? I know that there are some medical terms you may want to use and some others, but just tell us in very simple term how doctors are able to diagnose hemorrhoids.
Okay. Very simple term. Okay. So first of all, what doctors do is to get the medical histories. They'll likely ask you questions like, what are the symptoms you're having? What are your eating habits? Because to avoid, or what causes, I told you one of the causes of hemorrhoid is low fiber diets.
Yes, low
Then your
fiber
toilet,
diet. Yeah.
then your toilet habits, and then your current medical conditions. Because there are some conditions that can cause hemorrhoids, like chronic constipation and chronic diarrhea. Then for the physical exams, there are many diagnostic procedures they can do, which are the digital rectal exams, where they will insert a lubricated and gloved hand inside your anus to feel for any tenderness there and any bulging
Okay.
skin. Then there is anoscopy. Hmm. They're just putting let me say, a rod or a tube. That tube is called a probe. They're putting it inside your
Okay.
anus, and you
Okay.
use it to look round to check if there's an internal hemorrhoid. There are others like proctoscopy, colonoscopy, endoscopy. I don't want to verge into that, but that's basically it.
Okay. Okay. Thank you very much.
Okay.
Um, okay, so before we continue, this is just a disclaimer that this live session is not in any way a consultation, and whatever is to be discussed here is just for educative purpose only. Okay, so moving to the next question. What are the most effective treatments of hemorrhoids? Please, Nurse Duchess, can you hear me?
Yes, I can hear you.
We try as much as possible not to mention drug companies and the rest, because I think that is a policy
No.
on YouTube. Yes.
Okay.
So just tell us the most effective treatment for hemorrhoid.
Okay. So before I actually go to the most effective treatment, I'll say that before treating hemorrhoid, before a doctor says they want to treat hemorrhoid, they should
Okay.
first, the patient should first feel a symptom. You understand?
Okay.
So
Yeah.
because the doctor have diagnosed or seen during the whole diagnostic procedure that this person has a hemorrhoid doesn't mean that they should start treatment. Why? Because some of this treatment can cause some dangerous complications. Now, the most effective treatment is the surgical treatment for hemorrhoids. There are three types of treatment for, but the most effective one is the surgical treatment, and there are three surgical treatments. Hmm. The names are
Okay.
long, but
Just try to break it down, please.
there is the open or closed hemorrhoidectomy. Open or closed
Okay.
hemorrhoidectomy. Yes, that one they're just making an incision. Then, as they make the incision, they make sure to bring out all those accumulated blood and also allow it to necrose, that is dry up. There's the
Okay.
stapled hemorrhoidectomy and there's
Sorry,
Doppler guide.
please. Sorry, I would cut you from here. It's when you
Okay,
say an incision. When you say an incision, for those that may not really understand, what does that mean?
a cut.
A cut. Okay. Okay. Yeah, please go ahead.
Okay, there's the stapled hemorrhoidectomy. That one, there's a particular device that
Okay.
pushes the hemorrhoid inside and then staples on it so that there will be the blood supply to that hemorrhoid cut off and blood will no longer accumulate in that particular hemorrhoid, causing it to die off. Then the Doppler guided
Okay.
on. So that is it for the most effective. There are other treatments as well if we would love to hear, but no problem.
Okay. Thank you very much.
You're welcome.
Okay. So the next question I would ask here is what people oftentimes think is the right thing to do. And that question says, does hemorrhoid or can hemorrhoid go on its own without any serious treatment, whether it is home remedy or um, hospital remedy? Can it just go on its own without a treatment?
Yes, it depends on how on the type of the hemorrhoid and also how large it is, the size of the hemorrhoid. For hemorrhoids that are large, they cannot go on
Okay.
its own, no matter what. But I would say that even despite how small the hemorrhoid is, if it has passed 7 days and the hemorrhoid is still there, then you should commence treatment.
Okay. So the size it is a factor. Can you hear me? Hello, Nurse Duchess.
I can hear you. Can you hear me? Hello?
Are you still here?
I'm still here. Can you hear me? Hello? Can you hear me?
I can't hear you, please.
Hello? Can you hear me now? Hello?
Yes, I think it's better.
Okay.
Network.
Okay. Hello?
Can you hear me?
I can hear you. Can you hear me?
Yeah, I can hear you, but you are a bit low.
No. Can you hear me?
Yeah, I can, but you're very low. Please just try to be audible a little.
Okay. Hello?
Hello, Nurse Duchess.
Hello, sir. Can you hear me?
Yeah, I can hear you now.
Okay.
So I would go ahead with the next question.
All right.
Is that fine?
Yes, it's fine.
All right. So the next question here says, what complications can arise from untreated hemorrhoids? What are other complications that are associated with hemorrhoids that are left untreated, especially for a very long time?
All right. All right. So there are a number of complications, but I'll just mention few. There's anemia. I want to say that the one symptom of hemorrhoid is bleeding. So if left untreated, the person can develop anemia. Then there's blood clots. There's also skin tags, anal fissures. Anal fissures are just basically anal tears, like tear in the skin around the anus. Then strangulated hemorrhoids. Strangulated hemorrhoids, another name can be called thrombosed hemorrhoid. That is when blood clots are accumulated in the hemorrhoids, and that is very painful. I mentioned it before. Then there's
Okay.
infection, and lastly, prolapse. Prolapse meaning when the veins around that area that is swollen collapses and it shows externally, like in the anus region, you can see it.
Okay. Thank you very much.
Welcome.
Can you hear me?
I can hear you.
Okay. So I would go straight to the next question.
Okay.
Now, when should you consult a doctor on or about hemorrhoid?
When the
When is
symptoms
the ideal time to consult a doctor about hemorrhoids?
okay, it's when the symptoms start. When symptoms start. And also when after you've seen the symptoms and then you started the home treatment and yet it has still not gone after 7 days, that is when you consult the doctor.
Sorry, I am having a problem with your audio. I can't hear you properly.
Can you hear me now?
Yeah, I can. It's better.
Okay, like I'll put my mouth on my speaker. So it's I said that
Okay.
it's when the symptoms starts, and then also after you've developed the symptoms, or someone has developed the symptoms and they've started home treatment, and yet it has still not gone after 7 days. That is also when
Okay.
you see the doctor.
All right. Thank you very much.
Welcome.
So the next question, I think this should be the the last question, and this is the most important, especially for this live session. What are the preventive measures of hemorrhoids? What are the things we should not do? What are the things we should do if there are lifestyles that can actually cause this hemorrhoid? Please, I would want you to let us know.
All right. Well, based on the causes, as I said, hemorrhage is caused by pressure or by pressure. So you should know that you should not sit too long or sit too long in the toilet, because most of us are fond of that, especially when we bring phone inside the toilet. Don't sit too long.
Okay, so your first preventive measure is to avoid sitting too long on toilets.
Yes, sitting too long on toilet, and also sitting too long normally, because as I'm sitting now, there's pressure around my pelvic region. So
Okay.
don't sit too long. Then another one is to drink plenty of water throughout a day. So basically, we all know that the
Hello.
hello,
I have lost your audio.
can you hear me?
Yeah, I can hear you now. Please go ahead.
Okay. I said you should drink plenty of water throughout the day. Then eat more
Okay.
high fiber diets. Basically, fruits, vegetables, whole grains, and since most of these things we are eating daily does not contain the amount of fiber we're supposed to take, you can also take fiber supplements, but this should be according to what your doctors prescribe. Okay, then stay physically active. Then sits bath is just
Sit
basically
back.
yes. So sits bath is just basically sitting in a 3-inch warm water for 15 minutes several times a day. Now, why is sitz bath actually important? It's because it reduces the risk of swelling in that area. So that's why it's important. I know that they mostly recommend this for pregnant women after
Yes.
episiotomy. So me too, I was surprised when I saw that it's actually a prevention for hemorrhoids.
I was thinking it's just for pregnant women.
Actually, and also
Okay.
Kegel
Okay.
exercise. Kegel
Also
exercise.
what?
Kegel exercise.
Oh, Kegel exercise.
Yes.
Okay.
Yes. That, or another name is pelvic exercise, pelvic floor exercise. So you know when you have the urge to urinate, but
Yes.
you can't at that moment, so you just hold it in. So that
Okay.
muscles you're using to hold it in, that is the muscles you'll be exercising in this Kegel exercise. So you
Okay.
hold it in for like 5 seconds, then release it again for 10 seconds, then vice versa, like that. That's just the Kegel exercise. That's it.
I've lost your audio. Hello, can you hear me?
I can hear you. Where did you lose me?
You were explaining. I lost you at 5 seconds.
Okay, so I said you will hold that muscles for 5 seconds, then
Yeah.
release it for about 10 seconds, then do it again. Doesn't care how many times you want to do it, maybe 1 minute or 1 minute every hour, no problem. But that is it. So it's
Okay.
30.
Can you hear me?
I can hear you.
Okay, so thank you very much. I would need you to do a very quick summary because that's the last question. I would need you to do a very quick summary on all the questions I've asked, at least for those that are just joining us. I asked what are hemorrhoids, what causes hemorrhoid to develop, the common the common causes of hemorrhoid and who is at risk, the symptoms to watch out for in hemorrhoids, how hemorrhoids are being diagnosed by doctors,
Okay.
and if hemorrhoids can actually go away by themselves. When should you consult your doctor about hemorrhoid? What are the complications that can arise from untreated hemorrhoids?
Okay.
And the preventive measures. Please just give us a summary of hemorrhoid.
Okay. So as I said before, hemorrhoids are basically the common name for hemorrhoids are piles. They are swollen and inflamed veins around the anus and rectum.
Please, can you amplify your audio?
Can you hear me? Is it better
Yes,
now?
but it's very low.
Is this better? Hello? Hello? Hello?
Yeah, I can hear you. Just go ahead. Go ahead. Your audio is low, but just go ahead.
Okay. I said that hemorrhoids are commonly known as piles and they are
Pile.
swollen piles, yes.
Okay.
piles, and they are
Okay.
swollen and inflamed veins around the anus and the rectum. Now, the most common cause or how it affects the body, sorry, is it causes pain in that area, itching, and then sometimes bleeding. Then
Okay.
the causes are pressure, pressure around that area, basically. So, and then there's pregnancy, as I said, overweight, not eating, fiber diet. Then which other question again? The what is the third question? The third question was the risk. Shey? Who is at risk? So who is at risk? Who are the people that are at risk? They are the pregnant women, people
Okay.
that are of the age of 45 to 65 years. I told you why. Then those who have chronic diarrhea and chronic constipation. Then all these heavy weight lifters and pregnant women, as I said before, and those who are overweight. Then how do doctors diagnose this? I said before that is they'll first ask for your medical history, the symptoms, your eating habits, toilet habits, then the physical examinations where I mentioned a few. Some of them were the digital rectal exam, anoscopy, and all that. Then the most effective treatments for hemorrhoids, I said that there are basically three treatments for hemorrhoids, but the most effective
Okay.
one is the surgical treatment. And I mentioned three, which their names are heavy. But the common one we all know that, sorry, the common one is the hemorrhoidectomy, open and close hemorrhoidectomy. Then, can hemorrhoids go away on their own? I said yes, they can go on their own depending on the size and also the type. So if it's a
Okay.
large hemorrhoid, it cannot go on its own, you need treatment. Then even if it's small and um, after 7 days it has still not gone, you need to start treatment. Then the other question, when should you conduct a doctor about the hemorrhoid? Is when the symptoms show. basically, that's just it. And what are the complications? The complications of hemorrhoids are anemia, anal tear, skin tags, infection, prolapse, etc. Then the last question was, how can hemorrhoids be prevented?
Prevented, yeah.
Yeah, don't sit too long. Don't sit too long in the toilet. Drink plenty of water. Eat more high fiber foods. Then stay physically active. Sit bath at least 15 minutes every day. Then the last one was the Kegel exercise, and I
Okay.
explained it. So I believe that's all.
All right. Can you hear me?
I can hear you.
Okay. Thank you very much. Please, can you recap on the processes of the Kegel exercise? How do you carry out the Kegel exercise?
Okay, I said before that the muscles you use to hold your urine, you you're going to hold that muscle for like 3 to 5 seconds. After you hold it for like 3 to 5 seconds, let me say the highest should be 5 seconds. Then you release it for 10 seconds, and then after that 10 seconds, you do it again for that 5 seconds. It does not matter how many times you want to do it in a day, but even if it's like 1 minute in 1 hour, 1 minute in 1 hour every day, in every 24 hours, no problem. So that's just it.
Okay. Thank you very much, Ms. Duchess.
You're welcome.
Yeah. So thank you guys for watching. Thank you for joining up. A quick one. Our guest is a registered nurse, a registered midwife, and a registered nurse of public health. So thank you very much, Ms. Duchess, for joining me today. And for our audience on the live, please, if you have any question, you can drop it in the comment section. I'm sure she'll be here to reply to all your questions. And like I said before I started, we do this on this channel once every month. We go out of our way to get professional health workers to come discuss important and salient health issues here. So do well to subscribe to this channel, please, and also click on your notification buttons so that whenever something like this comes up, you'll be notified. So thank you very much for participating, and we appreciate. So see you next month. An update will be dropped on the topic for next month and our guest for next month. So once again, thank you very much, moderators, for joining me.
Welcome. Thank you. Thank you for having me.
Okay, so we are going to end the live session now. So if you have a question, just put it down in. Okay, I think it's network. The live session is echoing. I think it's network. So please, if you have any question, just put it down in the comment section. Thank you very much, and see you next month in our live session.